morning, ladies and gentlemen. Welcome back to the Weekend Wellness Workshop. Dr. Dennis Courtney with you, as I'm with you each and every Saturday and Sunday, 10 to 12 here on Pittsburgh Talk Radio, 1320 WJAS. Now, each and every week, we try to bring a medical topic to you and illuminate it to make you so much more aware of how you can apply this knowledge to yourself. And remember, the whole intention is to get you optimal once again. Goodness gracious, there's no way that I think I've learned to do this more and to such a greater extent than dealing with the issue of thyroid disease. And it really caught me off guard as a medical doctor to learn how pervasive and how prevalent thyroid disease really is. Now, ladies, this show is really dedicated to you. After all, you're the ones that made it happen. You're the ones that compelled me to studying more, learning more about it, because it seemed one after another of you kept coming to me with thyroid disease written all over their face and certainly all over their medical history, and unfortunately, their doctors were not listening. Now, men, you need to pay attention too, because you need to understand that your lady, your wife, your significant other has a set of medical issues that make her feel awfully bad, and it is not her fault that she does so. Now, I intend to let you know how it is that you can get this turned around on behalf of your wife and get her back and established to normal, healthy thyroid again and have all these symptoms go away. Anyway, that's my intention. Hope you enjoy it as the show unfolds. Let's start out with a couple of general concepts I believe are a great starting place for this show. One, you've heard me say over and over again that I do not use drugs. That's very unusual for a medical doctor to boast. And I literally do boast of the fact that I don't use any medicines. I mean, here I got a prescription pad sitting in front of me. This prescription pad collects dust. Why? Because I choose, and I've learned that I have options available to me to allow me to treat just about anything I ever need to and not use pharmaceuticals to do it. Literally correcting the problem so that the symptoms that are provoked by that problem are erased simply because the problem no longer is that, meaning that a medical problem. Can we also get to agree on one thing? That hormones are not drugs. If you are supposed to have a hormone and you don't have it, and a medical doctor gives you that hormone, you're not taking a drug. If you're supposed to have thyroid hormone and you get it given to you by prescription, it is not a drug. It's a hormone you're supposed to have. And all we're doing is making certain you have the correct amount and quantity of a hormone that you're not able, for some reason, you're not able to make. So, let's agree on that one. We should say that if you need a hormone, then you should take the hormone. Now, I say this because I know there's all sorts of great intentions out there by practitioners, health practitioners, and I've heard about every yam and flower petal and root that you can suck on that's supposed to bring back the gland in question and allow you to produce more of the hormone that you absolutely need to produce. But I got to tell you, I certainly have studied the yams and the roots and the flower petals, and you can't get a hormone back in functioning by sucking on a root. You really do need to have the hormone itself. And the way it works out right now is it's going to have to be written as a prescription by a medical doctor. And so let's just say this much. If whatever you're doing for your own situation, let's say thyroid or adrenal or ovarian or progesterone or testosterone, or you just name the hormone, if it's not a prescription that you have to fill in order to get it, then you are not on that hormone, and you are severely lacking the capabilities of being able to function once again by virtue of not taking the hormone. You need to take the exact hormone that you require. Today we just have to be talking about one of them. Let's talk about how this all began. Because I'll tell you, my medical training didn't get me prepared for what I found in medical practice. You see, I kept meeting you ladies, and I'm talking about you ladies in particular now. I kept meeting you ladies out and about in social settings, and we clutched hands, we shook hands, we tissue met tissue, hand clasped the hand of another, and over again, you did it to me. Now, what you did, first didn't go really recognized as such, but it kept happening. And it kept happening over and over again. You kept throwing me this cold fish handshake, throwing an ice cube in my hand, and it was so obvious that there was something wrong that it caused my brain to trip and think, there's only one of two things that could be going on here. Number one, and I've got to be prepared to think about it always, number one is, this is Raynaud's syndrome. Raynaud's syndrome is a rare disease. It's found mainly in females, but it's a trigger whereby which the peripheral vasculature, the blood vessels of the hands and the feet, clamp down, the vasoconstrict, and those extremities do get extremely cold. They go beyond cold. They actually turn discolored and mottled and a whole host of other things. So getting a cold fish handshake from the ladies, that was the first thing that entered my mind. But the second thing that entered my mind, over and over again, that this must be and could be thyroid disease. And lo and behold, even though Raynaud's is a possibility, what unfolded was the awareness that absolutely, positively, in Western Pennsylvania, our ladies have a known reason for why they suffer from thyroid disease so frequently. And it all dates back to the fact that we are born and raised in something called the goiter belt. Now, the goiter belt is a known scientific phenomenon. It's known by all scientists across the entire world that here in Western Pennsylvania, something odd happened back when the glaciers melted. I'm going back that far, folks. Yes, the glaciers melted. The land masses formed, and the mountain ranges formed, and the valleys and the rivers and the lake formed. But something happened here that didn't happen to any other place in the world. And what that is that we were washed out of iodine from our soils. There is no iodine in the soil. And iodine turns out to be a big player in a normally functioning thyroid. That was the setup. That's why I clasped so many hands here in Western Pennsylvania from women throwing me that ice cube. And if I hear one more time how warm the heart is with a whole cold hand, I'm going to scream. That cold hand is abnormal, and don't you think for one moment that it can't be changed and turned around, and no matter what age you are, it certainly can be changed and turned around. Now, this goiter belt turns out to lead to thyroid disease, and here's why. You have a thyroid gland. You know, located there in the region of the throat, the Adam's apple area. And this gland makes a substance, and the substance is known as tyrosine. And tyrosine is a complete biological dud. I mean, it has no biological activity. You are supposed to take that biological dud, ladies and gentlemen, and through your diet, which should have plenty of iodine in it, take and put 4 molecules of iodine onto 1 molecule of tyrosine to make something called, now get a load of this, tetraiodothiazine, and we absolutely abbreviate that and call it T4. Now, that's the first step. There's another step. The liver has to cleave off one of those iodines to make the final active hormone, thyroid hormone, called T3. In Western Pennsylvania, you never get to the first step. From your birth, you do not have foods that have any iodine in them at all. They're grown here in western Pennsylvania. And if I'm learning this correctly, a lot of stuff that gets trucked in is not very iodine-laden either. The bottom line is you can't ever get enough iodine to iodize your thyroxine to get anywhere near the thyroid hormone that you're going to require. This is the plight of being born and raised in western Pennsylvania. Now, we should make a special pitch and a special mention of why the female has the predilection to developing the thyroid disease when the men don't. We're both born in western Pennsylvania. I certainly am a western Pennsylvania native. Why is it that I treat so many women, hundreds of women, and so few men? And it really is in the teens in terms of the number of men that I treat. And to get the answer to that, we got to go back in time and learn one additional fact about iodine. You see, iodine has a number of every tissue has iodine receptors. There's not a place in the body that doesn't require iodine in some quantity in order to enable that part of the body to function properly. But there are two tissues in the body that have massive requirements for iodine. The number one, we just got done saying, is the thyroid gland. It can't function unless a large amount of iodine is available and available daily. But the number two tissue, the one that comes in close second place, believe it or not, is the female breast. And now a story starts to unfold that begins to divide why it is that the female are so afflicted and the men are not. And it goes something like this. Our children, born and raised in western Pennsylvania, are equally deficient in iodine and therefore equally deficient in the ability to make the appropriate amounts of thyroid hormone. They just get by. But what happens is when our girls enter adolescence and they begin breast development, the drain for iodine goes through the roof. And so the female breast is requiring a large amount of iodine to function properly. The thyroid gland is requiring a large amount of iodine. The body is trying to split virtually no iodine to begin with into two different piles of iodine. And the fact is, neither of those two get the iodine, neither of those two function well, and hypothyroidism begins in our adolescent girls at that point and continues on well into the future unless somebody steps in and changes this and turns it around. So, I've had parents sitting in this office say to me, I had this wonderful little daughter. We lost her when she went into puberty. And I think the inflection is, the hormone struck and the progesterone and then the estrogen, and then she hasn't been right since. It wasn't the estrogen and progesterone that caused the havoc. It was the lack of the ability to make any form of thyroid hormone. And when the breast drain began with breast development, the symptoms began. And yes, she went crazy, all right. We're going to be talking in a moment when we come back from the news what those symptoms are. Lady, I want you to get a pencil and paper and start jotting down the top 20 symptoms and whether or not it applies to you, because we're going to be allowing you to come up with being able to diagnose if you have thyroid disease or not, irrespective, and I got to say, irrespective of what your doctor may be telling you. I believe it's a great letdown on the part of the medical community. These practitioners, these doctors that you are treated by, they're born and raised in western Pennsylvania. They certainly understand the goiter belt. The problem is they do one thing that screws them up. They order those blood tests. We're going to be talking about those blood tests as a not-to-do step, because how many of you have been shut out of being treated appropriately for all these years because you had a blood test come back that was normal, and you need to be a used car salesman to sell your doctor on the fact that you should be treated with thyroid hormone with normal blood tests. So we're going to do this. We're going to take a short break, come back, and we're going to plow through the top 20 symptoms of thyroid disease. Ladies, I think you'll be hearing and seeing yourself in them. We'll return in a moment. Enjoy the news break. Be back more on thyroid disease in just a moment. Good morning, everybody. Welcome back to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney with you here on a Saturday morning. Of course, we're with you each and every Saturday and Sunday at 10 to 12, bringing to you health topics to hopefully enrich your knowledge about how to make yourself optimal once again. Today, we're working on a very important topic, one that caught me by surprise as a medical doctor, but certainly it's coming at me each and every time I meet, especially the ladies, and becoming more and more prevalent with a lot of the men that I'm seeing too. But it all starts with a real exploration of this thyroid issue, and most commonly, and it's moving up in the high 90% range of women that I have to start out our relationship, no matter what they come to the office for. It ends up that we're going to have to start with a thyroid because this has never been dealt with effectively throughout this woman's entire lifetime, and certainly needs to be dealt effectively now. So, as I mentioned just before the break, I believe the biggest mistake in the conventional medical world is the fact that it all starts, according to my medical training, and I'm very well aware of it, that we're supposed to check your blood levels of T3, T4, and TSH. Now, we won't necessarily have to get into a big deal with what each one of those really means, except to say that 90% of the time, those blood tests are completely normal. And in the world of conventional medicine, you will not be able to convince any doctor who sees normal blood work to even consider the possibility of thyroid disease from that point forward. It's the big mistake. It's the big problem. It's what changes the atmosphere for that particular patient, consigns her and sometimes him to a lifetime of devastation. Because thyroid disease ensues, symptoms accrue, and so when it's time for me to evaluate the thyroid, I'm going to get the blood testing, except I'm not going to use blood testing to determine whether or not you're going to be treated. Oh, no. There are three things that I use to make that call, and I keep finding these three things over and over again are so glaringly abnormal that my job is relatively easy. It's not usually a close call. So let me share with you how you need to be looking and maybe able to diagnose your own thyroid disease, and may be able to do it right after our discussion this morning. So let's start with how you feel, ladies. I've got a special list of the top 20 thyroid symptoms. By the way, there are hundreds of thyroid symptoms, more than 200 thyroid symptoms. We just picked the top 20 when we start our discussion here with our ladies here in the office, and I'm going to go down through that list relatively quickly, and I'm going to guess that if anything is anywhere near the way it happens in my office, the eyeballs are going to pop open because you're going to see yourself in these symptoms. And don't dissuade yourself from thinking anything other than what the intention is here. These are thyroid related until proven otherwise. Here we go. The number one symptom at the top of the list, my goodness gracious. Cold hands, cold feet, cold intolerance. Women are cold all the time, and I don't want to hear about the postmenopausal women who come to tell me, you know what, I'm not cold, I'm hot. And then I say to them, well, hey, up until menopause, were you really hot at all, ever? And then they think about it and go, oh, no, I absolutely was not hot up until menopause. I get hot flashes now. That's a different thing. That's a cutaneous thing that happens at the skin level. The core body temperatures haven't budged, however, and so cold hands and cold feet. That cold handshake that was thrown into my hand for all those years had definite significance. It's the primary symptoms, the one that usually tips me off to non-verbally telling me a lot about you, without ever having you open your mouth. Number 2, another big one, morning accentuated fatigue. Oh, the eyes pop open then. You need a crowbar to get out of bed in the morning. And you literally do need that crowbar because you just don't have enough energy to move. How about this one? Forgetfulness and short-term memory loss. Remember, thyroid hormone is responsible for your metabolic rate. There's not one body tissue that isn't directly affected by an improper amount of thyroid hormone because the basal metabolism of that area can't function without that kind of stimulation. And that's why so many symptoms are found as part of the complex of hypothyroidism. Next is constipation. I find this to be less frequent, although I do hear patients say, well, no, I'm not constipated, but I do take Metamucil and this and that and whatever, and or I take a large amount of fiber. All now work part into the routine so much that you don't even think about the constipation that you once had, because to make you so-called regular, you have to take a whole host of nostrums in order to make what should be happening naturally occur. Just that, naturally. Another, a slow pulse. We'll ignore that one for a bit and get back to that in a little bit because it turns out to be it's an awful big one. Next one, flaky, dry, rough, skin. Absolutely part of the hypothyroid process. How about this one? I have ladies who complain to me an awful lot about hair loss. Your hair falls out easily, or your hair is coarse, or it's lifeless. And hair issues usually are a large complaint worn on the sleeve of a patient that happens to see that we're moving into an arena of a whole list of things that never seemed to get solved before, and we're now talking about. Now comes the first of the many emotional components of thyroid disease. Depression is one of those very terrible emotions that have a physical reason for why. And it has to do with the right amount of thyroid hormone. We can get depression turned around. If it's minimal to moderate, thyroid hormone alone will seem to do it. Now, another one of the many gynecological manifestations, irregular menstrual periods. I meet ladies that are regular, of course, but I meet so many that are all over the board. And that is a dead tip-off to having a thyroid connection. Another set of emotional components, listlessness, irritability. Another set of symptoms, puffiness of the face and eyes. Another group of symptoms, muscle and joint aches, the myalgias and the arthralgias. This thing called fibromyalgia, by the way, you cannot treat fibromyalgia unless you have corrected thyroid disease. And how many of you afflicted with fibromyalgia are having that particular component of your fibromyalgia even assessed, let alone corrected? Headaches, in particular vascular headaches, but you wouldn't know whether they're vascular or not. You just need to know if you're having frequent headaches, they're more than likely thyroid related. PMS, which is a whole host of issues that come just about the time of the month when you're having your period, ladies. And these are very much accentuated in some women, and they're related to thyroid hormone. Another symptom, accentuation of allergies. Another, premature gray hair. Oh, this one. Oh, my goodness. Do I find women completely frustrated over unsuccessful dieting. I got to tell them, look, promise me this. While we're working on getting your thyroid back to normal, will you please not worry about trying to lose weight for right now? Because even if you did, and even if you could, and I would never put it past a woman to not take it on personally that I claim that it'd be very difficult to lose the weight. Oh, no, she'll lose it. But she can never keep it off because the metabolic rate is not up high enough to be able to burn off the very foods it takes to maintain a basal metabolic rate. So unsuccessful dieting and weight loss without even trying is one of the great positives of getting thyroid hormone back and working. How about this one? Infertility. I don't believe it's looked at enough by the experts at McGee and other fertility institutions. Thyroid hormone can get this problem straightened out, and so it should be the first place to go. I'm not saying that sophisticated in vitros and other things are necessary, but you got to start with the basics and then work up toward the sophisticated, and it all starts with a perfectly normally functioning thyroid. Next, poor concentration and retention, and then finally, mood swings. I mean a whole host of mood swings. I mean volatility. I mean sometimes, how about this? You better stay away from Mom today. Mom is on a rampage. This is something that Mom really can't help. This is a physical disease manifestation, and it can be corrected if properly diagnosed. And these symptoms automatically allow me to be able to determine, by listening to them alone and never going for the blood test as the deciding factor, these symptoms will direct me into this area and allow me to get very comfortable very quickly. When ladies fill out this sheet in my office, they're able to rate each one of these symptoms in a score from 0 to 5. 0 if it's not really some bothersome symptom. 5 if it's very bothersome. I will tell you, it's not uncommon for me to find a lady with 5, 5, 5, 5, 5, 5, 4, 3, 1, 5, 5, and just 5s, 5s and 5s. And by the way, I have the partner sometimes with them, the male partner, filling it out. It's 0, 0, 0, 0, 0, 0. The difference is so obvious. Women, they just don't know. And by the way, a lot of women get upset when they realize that their partner has no idea what they're going through. So, those are the symptoms. How did you rate yourself, ladies? Quite a few of those applicable to you? We're going to take a short break and come back and talk about the other two components that need to be put into the mix when making this assessment so that you're going to be able to make this diagnosis all on your own. We'll be right back in a moment to talk about basal metabolism, basal pulses, and basal body temperatures. And we'll talk more about thyroid when I return. Be right back.
Pittsburgh's Talk Radio, 1320.
Hello, Dr. Dennis Courtney here, host of the Weekend Wellness Workshop and medical director of the Courtney Wellness Center. I hope that you enjoy the show and the opportunity to learn what's available to you to make a real difference in your health. As a trained medical doctor, I'm well aware of how conventional medicine works. You go to your doctor with a problem. Your doctor puts you on a drug to alleviate the symptoms of the problem. You come back to further discuss the same problem, which usually continues without change, or the next new problem that gets added to the list. And then you go through the same process again. Don't you think it's time to stop the madness and take charge of your health and actually fix the things about you that won't allow you to feel optimal? The things that we discuss here on the show are things we actually do at the Wellness Center. They never require the use of drugs. They actually can and do correct the causes for why you're having those uncomfortable symptoms. Call the center so that we can discuss how we can get you feeling optimal again. Schedule a consult today. Call us at 724-942-3002. That's 724-942-3002. And keep on listening to us here each and every week on TW3.
Talk Radio, 1320.
Good morning, ladies and gentlemen. Welcome back once again to the Weekend Wellness Workshop. We're here today talking about thyroid. It certainly needs to be talked about. It's the number one thing that I'll have to confront just about every time I meet a patient first time, especially if that patient is female, and you now know why. You remember the thing with the iodine, don't you? And I've just ticked through the top 20 thyroid symptoms that I use as a checkoff, and most of my ladies have quite a few of those that are applicable to them. The diagnosis at that point is relatively easy. Now, there are two other additional, I'll call them objective quantifiers of how severe this thyroid disease is. And the first of these is the basal pulse. You see, when you emerge from sleep in the morning and you open your eyes for the first time of the day, the metabolic functions of your body at that moment are only controlled by one thing. And at that moment, everything is being controlled by circulating thyroid hormone. So in a basal set of conditions, we can learn a lot how severely afflicted you are for thyroid disease, because if that moment of emerging from sleep isn't met with the right amount of thyroid, the body functions are not going to be able to function properly. So the first thing we want patients to do is to check their basal pulse. I want them to check their pulse before they ever get out of bed. And by the way, they've never done that before. They may have checked it when they made it to the kitchen, or maybe they checked it after they leave the bedroom and go to some other part of the house, but they've never checked their pulse upon emerging from sleep. Now, I want to tell you, when you do that, these pulses get very scary. And I find them easily to dip into the 50 range and sometimes all the way down into the mid-40s. A 40 pulse is indicative of someone that's not very healthy. You cannot have a pulse in the mid-40s and have anything other than the ability even to get out of bed. That's why you need a crowbar to get out of bed. Nothing's moving around. So recording your basal pulse is the second helpful thing to do in order to assess your thyroid from day one, and will continually be what I'll use to help assess your thyroid as our treatment program moves forward. The third and the last component that's needed to be able to be used to quantify how thyroid afflicted you really are happens to do with temperature. Now, you're all familiar with this famous 98.6 temperature range that is supposed to indicate the normal walking around temperature. So that when you visit your doctor and he takes your temperature and he finds that your temperature is 101 or 102, he may say, oh my goodness, you know what, you're infected. I think I'm going to need to put you on an antibiotic to help contend with this infection, because the body's temperature goes up to fight infection. The point I have to get across to you now is your basal temperature is not 98.6. So that when you emerge from sleep and your eyes open for the first time of the day, you can't expect to ever have a temperature of 98.6, but you must have a basal temperature. Basal just means start of the day, beginning set of metabolic processes of at least 97.8 or higher. It must be at least 97.8 or higher. And here's where it really gets scary, because I got some ladies that come in the 96s, sometimes the 94s. I've even had the occasional patient come in with 94 range, and that is so abnormal. She's got a long way to go in order we're going to be able to correct that and get it back up to a normal temperature of 97.8 or higher. So now you have it, folks. Now you have the key to be able to make this diagnosis. You don't need a doctor to do this. You can do this on your own. How well did it go over those 20 symptoms? Ladies, how many of those did you check off? How many of those did you rate relatively high? That was your first hint that all these things that you've been complaining to your doctor about for years actually has a solution. Unfortunately, you showed up with a normal set of thyroid blood tests 10, 15, 20, or 30 years ago, and the moment those are recorded, the issue of thyroid never could cross your lips or his from that point forward. It was a travesty. It is a tragedy. It needs to be turned around, and it can be no matter what your age is today. The second thing is, without certainly my help, you can take your pulse upon emerging from sleep in the morning and look to see how low your pulse rate is. And it will be in a scary range of the low 50s or the upper 40s. Even if it's in the upper 50s, that's no day at the beach. That's certainly not a normal pulse rate, and it will have to be brought up to a normal pulse range well into the low 70s before we're ever done. So that's how we start. That's how it all begins. That's how the diagnosis of thyroid disease can be made, and you can make your own diagnosis at home. Now, I got to warn you, you can be loaded for bear and jot down all your symptoms. You can go ahead and take those pulses. You can record your temperature, but I think the skills of being able to speak to the level of a used car salesman will not help in order to get your doctor to even consider thyroid disease once the blood test indicates otherwise. So rather than trying to fight with that doctor, come on in to see us so that we can have this discussion and get you established and started and get you corrected literally on day one. It's usually the first step I have to take when I first meet a patient. We're usually, especially if it's a female patient, this is where we begin. And although there may be other issues, and there certainly are a long list of priorities that we're going to rank in terms of getting you optimally, we could never get you optimal if we did not have a fully functioning thyroid hormone. So it's so nice to see that by the time we've finished dealing with thyroid hormone, we're going to be talking with our guest in the second hour about how you do that, how it is that you really must work to get to the right hormone level when you're actually using the hormone, when you're not sucking on a root, when you're not rubbing a yam into your skin. And I know about all those claims out there. Believe you me, if you need the hormone, you better be getting the hormone. And our expert, Dr. Kerry, is going to be with us in the second hour to belabor this point really succinctly and get across to you how sophisticated this management should be to get you finally to the point where, number one, all those symptoms that you checked off on your checklist and that you may be rated of 4 or 5, maybe 3, 4, or 5, every one of those symptoms is fully reversible no matter what age you are, and that's an awful important message to be able to relay to you today. Number two, we'll be able to quantify how well you're doing with the level of thyroid hormone we select by monitoring your basal pulses. We'll have you take them frequently. You'll hear Dr. Kerry talk about this. After all, he's been my mentor and brought me into the realm of the 20th century and 21st century on how to treat this. And then finally, those basal temperatures are also going to be monitored and brought you up so that the cold hands and cold feet are going away. Your core body temperature is going to be over and above this 97.8 hurdle that none of you, when you take that temperature, are going to find yourselves to be above. That's going to be the reality that you can check out on your own. Then come on in to see us. Of course, you can make an appointment to come in to see us by setting up that initial consult. Just call us here at the office, Dr. Kim, the manager, the practice manager, and dial us up at 724-942-3002. That's 724-942-3002. Thyroid disease is rampant in western Pennsylvania, and it all happened because of that geological phenomenon that occurred during the glacial ice melting period that swept all the iodine from our very soils. Now, you need to be taking iodine. You absolutely do. But two things I'll leave you with before we take a news break and welcome Dr. Kerry as our guest today. The first is, if I happen to meet you and you're about age 25 or older, get ready for this. You're going to be taking thyroid hormone for the rest of your life. And so what if you need to take thyroid hormone? Because if you're not able to make it on your own and you're able to have a physician give you the hormone, do you really care? If all those symptoms that you suffer from can go away and the temperatures and the pulses can be normalized, if it takes a thyroid hormone to do it, then good riddance. You need to do it. And the second thing is, when it comes to taking thyroid hormone, there are certain preparations that you can select from, and Dr. Kerry will be getting into it. The iodine issue needs to be replaced. You'll need to take an iodine supplement. for every bit as much to help you with your breast health, ladies, as you do for your thyroid health. And we are very vulnerable here in Western Pennsylvania to breast disease. Got to some of the highest breast cancer rates in the world coming from Western Pennsylvania. And it's not by accident or not by happenstance that that's so. How this gets ignored by the conventional medical community is not going to be my concern anymore. It is to let you know that there's a better way to get these things turned around, and we can't wait for the conventional medical community to catch up. We're so far ahead of them right now. It'll take them a long time to catch up. You need to feel good today, tomorrow, next week, and next month, and it's all possible for that to happen. Okay, we're coming up to our news break now. When we return, we're going to be with our special guest today. His name is Dr. Roy Kerry. He is the godfather of alternative medicine here in Western Pennsylvania. He's our guest in the second hour. Be back in a moment with Dr. Roy. Good morning, everybody. Welcome back to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney with you down to Saturday morning. Of course, we're with you each and every Saturday and Sunday morning now from 10 to noon. Hope you enjoy listening along with us and maybe learning how to optimize your health. That's what we're all about here, and hopefully bring you a message of how you may see yourself improving. There's probably no better way to start out discussion to make you feel that way than to have that discussion turn to the subject of thyroid disease. To be able to cover that subject, I had no qualms about who I wanted to invite today. Turns out he is the godfather of alternative medicine, in my opinion, here in Western Pennsylvania. And he certainly has been my mentor when it comes to how to deal with many issues, not the least of which has been thyroid disease. So it was so nice to be able to consent to come aboard this morning. I hope you get to learn and meet our good friend, Dr. Roy Kerry, the godfather of alternative medicine in Western Pennsylvania. Let's say good morning and welcome, Boyd Roy. Thanks for allowing me to invade your Saturday morning, my friend.
Well, good morning, Dennis. It's been great to be with you. I'm having a little difficulty with this video hookup that's going to be on your website, but I think I got it just about lined up to keep me in the middle of the screen, sort of. Now, let me talk a bit about my background. Now, I went to Pitt for 12, 13 long years, and I graduated in 64, which is 50 years ago. But I became an ear, nose, and throat surgeon. Now, what did that have to do with thyroid disease? Well, I used to take thyroids out as a head and neck surgeon, so I got familiar with the thyroid problem. And then I became interested in the environment and allergies. In ear, nose, and throat, you have to treat allergies. And then my family had lots of allergies. My wife had environmental sensitivity. And so I got involved in the American Academy of Environmental Medicine. Now, I'm board certified in ear, nose, and throat surgery, but also certified in environmental medicine. Now, my certificate number in that's 32 in the world, so I'm a kind of a pioneer in this field.
32.
So what became of interest is the poisons in the world. The one I involved most with the thyroid disease is mercury. Now, the worst exposure to mercury in America is the coal-fired power plants, which are getting shut down. And we're shipping our coal to China. And they burn the coal, all things, and then they transport the pollution back through the winds from west to east. So we sell them the coal and they send the pollution back to us. But the other main pollution is the dental amalgams. Now, everybody in the world knows that mercury is poisoned except dentists. And, we discard fluorescent tubes carefully and that sort of thing, but dentists put mercury in our mouths. The silver filling isn't silver. It's 50% mercury, a little bit of silver, and 2 or 3 other metals to make it work. And it's a miraculous kind of product that fills a tooth nicely, but it's poison. And at body temperature, mercury is a liquid, and it off-gases and vaporizes into your membranes and up your nose, into your brain, and all that sort of thing. And it blocks thyroid function in a specific way. The understanding here, I think, is best illustrated by Dr. Jonathan Wright. I have an article I give everybody that there's 2 main reasons that blocks thyroid function. When you're doing the testing, I missed your entire discourse, but we do the lab testing, TSH and T4, which are almost unreliable. And I always do a total T3 and a reverse T3. Now, some people do a total T3, which I like best compared to the free T3. And the free T3 is the part that's active, but these are due to fraction. When I do these testing, the important point to me is that the ratio of the T3 over the reverse T3. If you get those numbers in the right denominations, and you have to be careful that it's picograms, nanograms, and milliliters and deciliters and all those things, if you get to in the right units, the ratio needs to be about 10 to 1. Now, if it's 7 or 8 to 1, you can get by with armor. But if it's less than that, 6 to 1, 4 to 1, I even had a 1 over 2 once in a person. When that's low, you can't get to the mailbox every day. Now, I put together an illustration here of, see if I can get it in the middle of the screen, get it right side up. But when you're looking at the TSH, that's the pituitary telling you to make more hormone. And it tells your thyroid to make T4. That's the hormone like the synthetic synthroid. Now, that's not the active hormone. The situation here is that you have to take one iodine off the molecular structure and make it into T3. But the T3 has just a receptor site in every cell in your body that only accepts the T3. It doesn't accept the T4. So the T4 technically is worthless. It doesn't act. Now, why would God make a hormone that doesn't work? That's reverse T3. It doesn't work. I use an illustration here also with an automobile. And my office is right at exit 96 on Route 79. And those people come to my place, these are coming across 80 or coming up and down 79. I ask them, how often did you use your brakes? And you hardly ever do. You are on your cruise control most of the time getting to my office. But all of a sudden, when you turn off, you need your brakes. And this is what the reverse T3 is. And this ratio needs to be about 10 to 1. And if it's not, you're getting too much brake. This is occurring inside your cell. Now, everybody in endocrinology thinks that the measurement of TSH and T4 are the end-all be-all. Well, in many ways, it has nothing to do with what's inside the cell. And this is probably a heretic saying to say that the TSH and T4 aren't even very important. In fact, in most of my patients, I have them 0.003 or something below normal. Now, that's
the TSH.
Yeah, that's a definition of an overdose to the endocrinologist. No, it's just enough. The pituitary knows better than any doctor, including me and you, what you need to make. If you take enough, your TSH goes to 0. That's where I want it. If it's not quite there, you need a little bit more. Your pituitary is saying, make some more hormone. And it doesn't even make the right one. It makes T4, which there's no receptor site for that. The receptor only accepts the T3. Now, let me switch to an electric illustration now. In your house, you have a lot of receptacles, and our cells have a lot of receptacles. Now, most of my receptacles in the house they have 3 prongs there that allow just 3 prongs to get in. Now, you might have some 220 in the house that requires usually 3 little prongs to go into the openings. Now, that may be your dryer and maybe your water heater, but all the rest have 3 openings. an active, a ground, and then the other little round ground. Now, with my illustration, I illustrate that a little different. That this receptacle here has that little ground off center. Now, the T3 up here has that configuration. You see, it will fit in there. This reverse T3 has a wrong iodine removed, and it doesn't fit. But it goes in there a little bit, just like if you take your plug from your sweeper and plug it into the receptacle just a little bit, you get no power at all. This is what reverse T3 does. If you have that 10-to-1 ratio, you have 10 of the receptacles inserting the active T3 to, well, what's that do? It regulates the amount of oxygen you use to burn your calories, your food, just like in your automobile. Again, I'll switch to that where the gasoline in your tank doesn't burn. It turns into a bit of vapor to explode in your cylinders. And that's just the same as the T4. It has to turn into T3 to give the energy of the cell receptor. The reverse T3 gets in there just enough to block the entrance of the T3, and so it's a regulator. The ratio is 10 to 1, you're doing fine. 7 to 1, you need a little help. At 2 to 1, so you can't even get to the mailbox once a day.
All right, let's do this, Roy. Okay. As you can see, ladies and gentlemen, Dr. Roy Kerry is very much up on the nuts and bolts of thyroid hormone. What I want to do, Roy, is we're going to take a short break. When we come back, I want to get to something much more basic for our listeners. That was very instructive for me. I thank you very much for the lesson. I would like to talk about how you treat your thyroid, because you're the one that brought to me a great protocol to follow. And I'd like for you to describe that protocol for our ladies out there so as to let them know that this is handled in a very practical way, and you will come up with the right doses for them. Fair enough, Roy?
Exactly right, yep.
All right, so, look, folks, we're with Dr. Roy Kerry. We're going to take a short break, be right back, and we're going to ease on off of the heavy medical stuff and get into the practical stuff. You're anxious to know, how will your thyroid be treated? How effective will that treatment be? I'd love to hear from Roy. I hadn't talked to him a while about this, about all the ladies he treats and how successful he is with that treatment. Maybe we can even compare notes. So, let's take a short break, and we'll be right back with Dr. Roy Kerry. We'll come up.
Oh, mate.
Here we go.
That help you?
Okay, here we are. We are back, folks. This is Weekend Wellness Workshop. I'm Dr. Dennis Courtney. Today the subject is thyroid, and we have the expert of thyroid. You certainly could tell you knew a little bit about it by explaining all those T4s and T3s and reverse T3s, and let's just say there is some benefit to the labs at a sophisticated level. We've talked about how to make that diagnosis for you, just even listening to us today, so you'll be able to know whether you, in fact, really do have a condition that should be treated. Now, Dr. Roy Kerry, a accomplished ENT surgeon, unfortunately, all of his knowledge in the environmental realm took him out of the operating room very early on in his career. He often talks about how his colleagues have turned into millionaires, and he's not, simply because he treats without the surgical blade. Very interesting to hear that from him. But he is the man to go to when it comes to thyroid treatment. Dr. Roy, are you with us?
Yes, back again.
Back again. Look, I would like you, because I claim that you're my mentor when it has come to how it should be that a doctor treat thyroid disease. And because your protocol was such a revelation to me, and it's something I use each and every day with the patients I treat, I figured you'd be the expert to take our listeners through how you work up a patient and how you make those early decisions about how to treat their thyroid. And you can get as general, as sophisticated as you want. After all, it is your protocol. Roy, why don't you take it? Go ahead.
First, of course, I look at symptoms. The office nurse happens to be my wife, takes a history over the telephone of the patient, and it may take an hour or more, and it covers 4 or 5 type pages to get the background of the patient. Most patients say nobody ever asks all these questions. It's important to get a thorough history. Then we get rather specific about the thyroid. Now here's my questionnaire. I hope it can come up there a bit. But it's
we talked about it. That's my questionnaire too, Roy. You gave it to me. The top 20 symptoms.
20 questions. Now, one of the illustrations, I have 78 different symptoms. I think my textbook, in fact, I encourage everybody to get this book, Stop the Thyroid Madness, by Janie Bothorpe. Now, this is volume 2, if you can see, written by her, but also she has 14 different medical doctors confirming what she did was all perfectly right. So this is a good book for everybody to get. In fact, her first volume is probably easier to read for the patient, and we'd recommend everybody get it. Now, it's only $19.83 on Amazon. Stop the Thyroid Madness, the first volume. The second volume is better for doctors because it has all the scientific explanations in there. So it's good to know the history. And the questionnaire I give everybody in the office. Now, the first column I have them fill in, a number 5 means that symptom is very bad. A 0 if you don't have it. One of my favorite patients had a 5 on every single symptom, including infertility. Now, how I use this is each time as I treat, I advance the dose very carefully over a period of 6 or 8 weeks even. And you do another column, and until you get to about your best dose, nothing happens. You get mad at me after about 4 weeks of doing this little chart, and nothing's happened. You haven't improved a bit in the 4 weeks. But week 5 and 6, all of a sudden you get well, and these symptoms start to disappear dramatically. But the treatment now is a choice of 2 or 3 things. Now, if you simply have a thyroid that quit, you don't have any mercury in your body, then you can use Synthroid. If you have mercury blocks the step of converting the T4 into T3, is making from the inactive to the active form, that requires selenium as that step. And this is where the toxic metals get in the way. If you look at the chemistry of selenium, it has 2 electrons on the outer ring, and so does mercury, lead, cadmium, etc. All these poison metals get in the way, and that doesn't let you mature the thyroid hormone into the T3 form, which goes into your receptors. So there we have to give just T3 if your ratio is much below 7 or 8. Now, Armour Thyroid has been around for, I think, 110 years or more, made from pig's gland. When it comes out of the pig, it's 20% to T3, and 80% is the same as the Synthroid. That's the way God made it, so being coming with the help of a pig, it's not patentable. I think they're almost trying to get this off the market because there's no patent rights to it. Although the price is going up recently. Now, the choice here is very dependent on that reverse T3 ratio. So if it's lower than 6, you always need T3. If it's Armour, 7 or 8 above, I start people with a 30 milligram tablet, and each week I go up 1 until it works. Now, most people, I also use it twice a day. I was recently criticized by a pharmacist who said, no, you shouldn't use Synthroid twice a day. It has too long a half-life. No, it doesn't. If you listen to patients, they tell you it's gone by supper time. We always have them take it in the morning. Now, Synthroid even needs to be on an empty stomach because it's not the mature hormone. It has to go to the liver and get converted and that sort of thing. Now, most of my patients then have one of these problems. 2 or 3 other toxins include chloride, bromide, fluoride. They look like iodine on the molecular structure, and they don't work either. They're poison. Everybody knows that these are poisons. We use them to kill bugs and so on our water and so on. So that's obvious. So most of us have that in us too. So you have to bypass both of these poisons. So often you have to use just the T3 form. Now the brand name of that is Cytomel. It comes as a 5, 25, and 50 microgram size. Now usually it gets very inconvenient because that half-life of that is only about 4 or 5 hours. So a person has to take that every 4 or 5 hours. Almost impossible to remember. Nobody can do it. So we have a custom-made T3 with a time-extended mechanism. We have local pharmacies, a compounding type, make it into different amounts. Now, there again, I start them at 7.5 micrograms in the single capsule, and I use that twice a day. At breakfast and supper, very much more convenient. Doesn't have to be on an empty stomach. And we build that from 7.5, 15 the next week, 22.5 the next week, and then 30 the next week. And many patients, I stop at that for a couple weeks to see if it's enough or too much. Now, the worst thing to do in thyroid treatment is give people too much. That's an overdose, and you find that usually when the TSH is 0. So how do you tell if it's too much? You have to look at symptoms. So we start looking at the symptoms of not enough thyroid. We have people mark that with these indicators of 0 to 5, and as they start to drop off, that means you're getting there. Now, we also watch the pulse carefully. I have people chart their pulse and temperatures almost on a daily basis to get there. Now, this form also has a list of the symptoms of too much and too little. And I tell people there's a tongue-in-cheek thing here that there's a better column is in the middle with no symptoms at all. That's what we're trying to strive for. We want the symptoms to progressively go away until you get the optimal dose and you start to feel good. And then you don't want overdose symptoms. So the middle column of my sheet, I tell people there's nothing there. There's no overdose symptoms, and there's no underdose symptoms left. Now, sometimes that doesn't work too well because any one of these symptoms could be caused by something entirely different in your disease process. So some of these you might have to ignore. Now, even on my illustration here with the picture of the person's face, so they're frowning because they're all unhappy and depressed. They don't have very wide eyebrows. That's another sign and symptom is lock of the lateral eyebrows. And hair thinning. Now, hair thinning, who wants skinning hair, but that's what we call it, is hair thinning. It comes from too much and too little. So you can't use that symptom very well. You have to use some of the other ones. Like the main one I almost forgot to put on there, and I just put it recently, was heart rate. Heart rate too slow, you're hypothyroid. Heart rate too fast, you got a little too much on board. So that's another excellent symptom. We keep raising the dose very gradually and carefully. I usually see the person again in about 4 or 5 weeks before they reach the optimal dose. I want to make sure they don't overdose. I want to reiterate what the overdose symptoms are, look at their little checklist, see how it's going, and keep raising the dose until it works. Now, that sometimes gets alarming. I had one patient that we were using the Cytomel pills, keep raising by half a tablet each week, and each week she'd come in and she's on 3 tablets a day, 25, that's 75 total. That's a common dose even with the time release. Then she gets up to 6, gets up to 9, gets up to 12, gets up to 15, and still has a 5 on every score. Now, if you add them up, 5 times 20 is 100. It looks like a percentage when you do this. I have people total that across the bottom of the page. And I even have this pre-punch to come back with the patient that goes into my chart to prove that I'm treating the patient carefully, watching the symptoms carefully. And this patient finally got to 16 tablets, and within about 3 weeks, she cleared every single symptom. Now, one of her goals for 5 years was pregnancy, and that was a common problem we see with, I think I'm working on about number 49 or something of helping women get pregnant. And so she came in, she was pregnant about 6, 8 weeks, doing fine, and had all symptoms well cleared with the proper therapy on an amount which was astronomical, and I still don't understand why. And I have a number of patients that require that high a dose. Most people go take 75 of the time release to maybe 82.5, and we make those increments. They can be done almost infinitely up and down with the compounding pharmacy. That's the basic treatment. Now, if a person has the armor working, I use 30 milligram tablets. And again, I take 1 in the morning a week, then I take 1 in the morning and evening, and then I take 2 in the morning and 1 in the evening. And I work up to often, many people take 30 milligrams tablets, 3 or 4 in the morning and 2 or 3 at night. I usually have people take a little less at night so they don't have a sleep problem. Also, I have to kind of coach them. Initially, those time-released capsules were thought to last about 12 hours. Dr. Dennis Wilson, who came up with this idea back about 30-some years ago and wrote his book about this, thought they lasted 12 hours. But my patients kept telling me, no, it's 8 to 10. So we tried to get them at breakfast and supper. Very convenient timing. To be honest, stomach full of food. And so we get to that. Now, in the Armor, I used to also split the dose. I often take, let's say, 330s in the morning, that's 90, and 2 or 3 at night for many people. Now, we're warned by even insurance companies that Armor is very dangerous because it has the active component in it. So we're warned if you're over 62, you shouldn't use it even. But this is an error of judgment. If you need it, you need to use what works. And Synthroid doesn't work, you have a problem.
All right, let's do this, Roy. We're coming up to a news break. When we come back, I'd like to switch a little bit of gears and talk about the success rate that you experience with your ladies, because I know it's really off the charts. So we're going to take that break. Be back again with Dr. Roy Kerry. The subject is thyroid. We continue in our return. Good morning, ladies and gentlemen. Welcome back to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney with you today on this weekend version of the show. We're with you each and every Saturday and Sunday from 10 to noon. Today our topic, a rather important one from my position as a physician treating so many people over such a long period of time, especially for the ladies. This is the number one thing on the chart that we've got to take a look at on day one, and it's so common to find that affliction that I thought it would be great to start our conversation about how to become optimal with it, and in so doing, bring you the godfather of alternative medicine, and particularly my mentor with thyroid disease. His name is Dr. Roy Kerry. He's been with us already for a half hour. We're in the gun lap portion of the show, and Dr. Roy, you still out there with us?
Yes, and one thing about this, I'm a man, so this happens to men too, but much less common. We see probably 80% women and only 20% men in our population. But they also need the same care. But the men don't have all these hormone swings back and forth. That brings up another thought here. If you have a failure, you have to start looking at many other things. So even some of the things that I talked about briefly, selenium is important to help the conversion. Now, if you're taking the thyroid hormone, whether it's optimal T3 or Armor or even Synthroid, if you take enough, it should reverse your symptoms unless you're missing some other element. So we need to look at selenium and its importance, but if you're taking replacement, it's not that important. But if you're not taking replacements, you should look at these briefly before you even start. If your selenium needs replaced, then it might convert. But if you have any mercury or any of these other toxins, all the selenium in the world won't do much.
Let me ask you a question, Roy. Let me ask you a question. There's such a correlation between iodine and a healthy thyroid. I haven't heard you mention iodine yet. What's your opinion about iodine? I'm usually a big proponent of taking it, especially for breast health, along with the thyroid. But how do you advise your ladies on the subject of iodine?
I finally just took David Bronstein's course about a year ago, and I'm convinced that everybody needs iodine. We're almost all deficient, especially around the Great Lake iodine deficiency belt, as we call it, the thyroid goiter belt.
The goiter belt.
That the iodine, you make your own hormone. So if we define the fact that you need replaced many times from all these other toxins, you even have enough on board, it's just being blocked. So looking at the iodine, especially as you mentioned, for breast health. Now, all of our organs that secrete need iodine. And it's one of the things we've used a real high dose for as an expectorant to clear our mucus and thin up our saliva. So the saliva gland is important. Breast tissue secretes. Prostate secretes. So men that have a prostate, they ought to be on some iodine for that, even if their thyroid's fine. Now, just being going through some of the other things. Vitamin D is important, vitamin C is important, your cortisol level. It's very common to have a person with long-term hypothyroidism as adrenal exhaustion. So we need to check the adrenal function. And there, I don't like to use the hormone replacement. That's cortisone, all my side effects. But we use glandulars, herbal products, and those kind of things for adrenal support. We need to look at gluten sensitivity, sensitivity to the gluten in wheat, and that needs tested. I don't like the idea of just trying to diet on that one. It's too important not to miss. And food allergy testing. We both know how to fix that with our low-dose antigen concept. This has been revolutionary for my practice to just be able to treat everybody. I used to test people. I had 10 nurses around the office testing everybody up and down both arms. I don't do that anymore. So we simply go to the low-dose antigen, but it fixes everything. The other thing that brings up is Hashimoto's allergic thyroiditis and Graves' disease. Not even mentioned those so far, but those are now fixable, I think. They've always been thought to be a genetic disease, and I had one perfect example of that it's not. I just see a young 10-year-old come in with Hashimoto's and began treating her, and a few months later, her mother came in. She says, I have it now. And I said, oh, that shows it's genetic, doesn't it? To the mother. And she said, no, you got that backwards. I got it from her. We now know it's caused by a bacterial infection. Excuse my voice there.
Sure. Clear your throat. It's all right.
It's a bacterial infection. The bacteria is called Yersinia. Now, nobody's ever heard of that probably until recently. In fact, in Dr. Jenny Boothorpe's books, the first time I ever saw the word printed, it's been a known bacteria for years. It's in the gut, though, and it doesn't make people sick. I always start this explanation with asking people if they know what causes rheumatic fever. And even medical people don't remember that now because it doesn't happen. That's a simple strep throat. If you get it and don't get treated, it turns into rheumatic fever because the antibodies you make against strep looks like your heart parts, and you begin to destroy your heart parts, valves and so on. But this Yersinia looks like your thyroid. And so if you get that in your gut, it doesn't make you very sick. It's an intestinal anaerobe. It doesn't require oxygen. It stays in your intestinal contents and doesn't make you very sick. But you make antibodies against your thyroid. That. Now, I test with the muscle test technique and can identify that in almost everybody. If I don't find it and they have the Hashimoto's antibodies already, and I always screen with both peroxidase and transclaminase antibodies on all patients because it's common. And if you miss it, we now can treat it. Now, most people that don't know about LDI don't know that can be treated, but I've had 2 complete clearings of Graves' disease. Now, Graves' disease is dangerous. It's too high a thyroid output. And usually you have to take part of the gland out, or you use poison, or you irradiate the gland, all these different ways, and they're irreversible once you do that. But with this Yersinia antibody, I've had 2 complete clearings. Now, these young girls had very high antibodies, very high thyroid output, dangerous, and we treated them with the LDI for about a year, and they now have completely normal thyroid blood test, are on no medication, and are completely healthy, and they'll not require any therapy for that, I hope, lifetime. I keep following them, but I think we've cleared their Graves' disease. Hashimoto's is a little more difficult. It seems that their antibodies persist in spite of the fact that we treat them for a couple of years. We simply add that to the low-dose antigen therapy, and it negates the antibodies. So our failures, I'm kind of guessing that we probably get success in over 80% of our patients with whatever we do with the replacement, most part. Then if we're not, we have to look at other things that might be inter-involved. Adrenal is very common, especially in people who've had it for a long time. They call on their adrenal for energy, and it wears out the adrenal production of your cortisol, and I don't like to put people on steroids for that. I had 2 patients in my practice on that because they were so far down. But by using the herbal products and getting the thyroid optimal, then the adrenal begins to recover, and will make its own. And the other thing is that I always use a real high dose of vitamin B5, pantothenic acid, and that's part of the building block of your adrenal hormones. And using nutrition all the way across the board with our patients as a part of our treatments is vital to getting the success rate that we get about 80%. I kind of tell people that anymore, I almost don't have to think. We just do our routine, and most people get well without hardly thinking. Just have to make sure your dose is right and picking the right form, and build the dose carefully and don't overdose them. And there's our success rate. Then we got to start thinking if there's other things that we have not gotten accomplished.
Well, the 80% success rate is absolutely on par with what I've experienced. Of course, I can thank you for getting an opportunity to explain to me this a number of years ago, and ever since you have, it's changed my practice around. The ladies, I tip my hat off to you. They're feeling wonderful again. They weren't feeling wonderful when we met, but they absolutely are feeling wonderful now, and it has to do with the fact that you struck out, and wherever you learned this technique from, however you developed, I will tell our listeners today, it's very difficult to find physicians that appreciate treating thyroid in this way, and you're one of them, and thank you for your tutelage so that you've made me one also.
Hey, just a moment, on a cheat and do a little advertising. Now, you're in the South Hills, I'm in the North Hills. I'm only about 40 miles from downtown Pittsburgh on Route 79, exit 96. My phone number is 724-368-3558. Maybe that's a hard number to remember. 724-368-3558. So people from downtown Pittsburgh to get to my office in 45 minutes, they can get to yours in 47, I think, isn't it?
It's okay with the plug, Roy. If you're up in the north and you're in his backyard, they're at Portersville exit at 79. Feel free to visit my good friend, Dr. Roy Kerry, the godfather of alternative medicine here in Western Pennsylvania. We're going to take a short break. We're going to come back. I'm going to quiz you a little more on something you placed on the top of your list when it came to treating thyroid, and that was heavy metals, and in particular mercury. I'm going to ask you how you take on that responsibility, and sure, when we return. So, folks, we got one final break to take before we go to the home stretch with you on the subject of thyroid. We'll be right back in just a moment.
Pittsburgh's new Talk Radio 1320, WJAS.
Hello, Dr. Dennis Courtney here, host of the Weekend Wellness Workshop and medical director of the Courtney Wellness Center. I hope that you enjoy the show and the opportunity to learn what's available to you to make a real difference in your health. As a trained medical doctor, I'm well aware of how conventional medicine works. You go to your doctor with a problem. Your doctor puts you on a drug to alleviate the symptoms of the problem. You come back to further discuss the same problem, which usually continues without change, or the next new problem that gets added to the list. And then you go through the same process again. Don't you think it's time to stop the madness and take charge of your health and actually fix the things about you that won't allow you to feel optimal? The things that we discuss here on the show are things we actually do at the Wellness Center. They never require the use of drugs. They actually can and do correct the causes for why you're having those uncomfortable symptoms. Call the center so that we can discuss how we can get you feeling optimal again. Schedule a consult today. Call us at 724-942-3002. That's 724-942-3002. And keep on listening to us here each and every week on TW3.
Pittsburgh's Talk Radio.
1320.
Good morning and welcome back, folks, to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney with you today. The discussion has been about thyroid, and quite a discussion it has been, and it just needs to have taken place, folks. This disease is rampant here in Western Pennsylvania. That goiter belt phenomenon has played itself out to the point where so many women, especially women, are afflicted. Now, we're here today with an expert in environmental issues, and in particular thyroid issues. His name is Dr. Roy Kerry. I recognize him as the godfather of alternative medicine completely here in Western Pennsylvania, and he's been sharing his feelings and what he's learned about thyroid disease over a career's worth of time. And so nice of him to share it with us today. Dr. Roy, you with us, my friend?
Yes, we're still here.
Okay, we're coming around in that home stretch. I wanted to let you take a little bit of time because you have always placed heavy metal toxicity high up on the list as things that needed to be investigated when dealing with thyroid disease. And so with all the years of experience that you have and the prominence of maybe the listeners of the age group that you're trying to reach, if they're in my age group, the mid-60 range, we all had mercury fillings. Nowadays, they don't use it too often, but the people who are listening to us right now of that era absolutely do. So take it away for a moment and talk about the relationship between heavy metals, mercury toxicity, and thyroid disease. Go.
You call me an expert. I'm going to define expert as it's an old drip under pressure. So I've been doing this for a lot of years. I studied about the mercury with Dr. Al Huggins in Colorado Springs, who came up with this idea that mercury was harmful, and of course the dental profession had him lose his license and all that sort of thing that happens in medicine. Like Dennis Wilson coming up with this idea of the T3 and using it so much, he lost his license in Florida. After he had treated 5,000 people and got them well, the endocrinologist there got mad at him and had him lose his license, and that happens typically in medicine where we don't accept new items. Good thing. So the mercury is a problem with, as you're recognizing, the older generation, now with many of the patients coming in with hypothyroidism in their 20s and 30s, they then may not have mercury fillings interfering anymore. There you have to look for all the other causes, and there often it can be the halogens, chlorine, bromine, and fluoride in the water and other sources causing the toxicity. So we look at the toxicities if we can clear them. Now the mercury, probably 2 or 3 fillings in your mouth is enough to cause interference. Any more than that is really obvious. Many people have 12, 14 fillings. Every molar and 2 bicuspids on each side are filled with mercury. These have to go. Now, many people of that age group in their 40s and so on have 4 kids to put through college, and they just can't afford it. Now, that's an expensive deal. I guesstimate to people that maybe about $300 a tooth. You add them all up, and you got 6 of them in there. That's a big piece of change. It also has to be done carefully. I have a list of what I consider competent dentists in my office. I share with people. There are some that are real competent, some that are only partially so. You have to protect the patient from the exposure of drilling the mercury out. I don't recommend pulling all your teeth either. And so you have to be protective. We have people use detoxification. We often have people use chlorella. That's a natural plant that helps bind mercury. We even have people chew a couple a day and get them in the gut, get used to it. Then the day you go in the dental office, you put 20 in your intestinal tract to catch the mercury they're doing from drilling. And after the dental work, you chew 2 or 3 and spit it back out to catch what's been in your mouth membranes. That's one little step. Otherwise, you don't get much progress on fixing the thyroid, so we just supply the thyroid medication until you get them out. Then you can then detoxify the mercury with our intravenous chelation techniques. Now, I think probably lead's just about as bad, and we don't pay a lot of attention to that, but we do chelation, which the main purpose of that is to bring lead out. All of these heavy metals interfere, and so if a person's high in lead from industrial exposures, they need to have that removed before you get much success. Now, I take some patients off the thyroid medication very gradually, and after they get the mercury out, and you prove it with the challenge intravenous test. And now, how much mercury do you need to interfere? Well, you can't even measure it in most people's bloodstream if they have a mouthful if you just do a blood test. There's not enough in it to measure it unless you do the challenge, but it's still too much, even though you can't measure it. Well, there's a few other metals that get to be worse. I even have some where chromium might be a factor. When people have a cobalt chrome hip prosthesis put in, I have some young people with that, and I don't see any mercury contamination. I can't figure out what else is making the reverse T3 go sky high. Well, there's one other thing that I forgot to mention. That's being on a diet. Now, that's genetic. I ask people to look at their background. If they have a Central European, German, Polish background, or Irish that had the potato famine, the Central Europeans died of starvation. That's the other cause. And simply being on a diet can do this. Now, every patient I see almost is overweight that has a thyroid problem. They've been on a diet for 10 years, and that's a starvation mode, and that puts the reverse T3 up. So if you see these now, about a 30-year-old that's been hypothyroid functionally for 10 years, they've been on a diet for 10 years, even though they don't call it that anymore. Just to keep their weight even, they are starving themselves a bit, and that shifts the reverse T3 up. That's the other major cause of the high reverse T3. So you almost have to get them overdosed. Well, we don't like that term. And the endocrinologists say you should never treat people with too much thyroid to make them lose weight. Well, I don't. I make it possible for them to lose weight. Yeah. If their thyroid's treated properly, then they can lose weight with a careful diet. One I like kind of is the intermittently diet, real strict for 5 days to a week, and then loosen up and gain a pound back. And that's a difficult feat to do without the thyroid completely controlled.
Well, heavy metals as the environmental doctor number, you said 32. Is that what it was? What's your ranking?
My certificate number is 32 in the world in environmental medicine.
32.
And we look at all the toxins and we live in a toxic world, and we can't get away from it. I have some patients with chemical sensitivity where they can't tolerate the fumy things, gasoline, diesel fume, perfumes, and so on. I have two right now that almost can't live in their own home, can't live in their car. They can't live in their home because they just put in new carpet, and all these toxins are interfering with other things. So we have to be careful, and we have to get our pollution factors down and live careful, eat organic food the best we can, and don't do toxic occupations any more than we have to. All of these things interfere with our health.
You had mentioned twice, and I'm just going to have you say a couple words on it because I think we got to come back one day in the very near future. You have also worked very closely with allergies, simply because as an ENT doctor, people are seeing you for your allergy ability to be correcting them. But way early on in this, you've learned non-surgical ways of doing it, and in particular now the use of a treatment called LDA. I wanted you to just spend a moment as we come to the final component of our show today and plant the seed for understanding what is LDA, because you treated the Hashimoto's patients who we were talking about a moment ago, as well as these highly reactive individuals that have immunological responses to various allergens.
LDA simply means low-dose antigen. Now, I've high-dose antigen for 40-some years, where we inject weekly and measure the exact dose and sneak it up until it's tolerated. This is totally different. The injections, if you even need them now, we even use sublingual, is every 2 months. If you just have inhalant allergies, that formula has all the dust, molds, and pollens, and cat and dog fur and donkey fur, I think, even, and whatever, and only 2 treatments a year. Now, usually we use in injections, but it can also be done with a drop sublingual. The foods, there's over 300 foods in the formula, so it covers all foods you can think of in the world, and it works well for that. Also, it covers chemicals if you need that. And the diesel fume, perfumes, hairsprays, and that sort of thing, and colognes and cleaning agents. But now, we now sort of call this LDI for low-dose immunotherapy. Now, that includes several bacteria that cause rheumatoid arthritis. The bugs called Klebsiella and Proteus. Bacteroides is another bug causes arthritis. The Lyme bugs, we're now up to 75 different organisms that cause Lyme disease, getting excellent results on that. And we'll probably discover more different bacteria that we can use, even strep and people with some of the emotional disease, even in children, use the strep organism. Now, again, these are diluted almost into homeopathic, but not quite. They're made active by an enzyme we add into all the formulas, beta-glucuronidase. It's a body enzyme that the Brits discovered this technique of enhancing the strength of these extremely weak, totally safe injections. We did the research back in 95 to 01. We treated over 10,000 people. We had 3 people drop out because of a side effect. Can you imagine 3 people out of 10,000, the only ones that didn't want to continue this? And amazingly safe.
I thank you for planting that seed. We're going to come back someday in the near future and have an entire discussion about LDA. I just wanted you to share with me, because you brought me into the 21st century with the LDA. You've been so helpful in guiding me in the right direction. Just wanted to make sure we let our listeners know that there's other treatments coming around that we'll be talking about when it comes to immunological response. So
let's do that after October 5th. Do you know why?
Why is that? October
5th, we learned some more things.
Oh, yeah, we have a meeting down in Florida. Exactly right. We'll be visiting with the 90. There are 90 LDA doctors in the country. Maybe it's up to 98 now, but it's in the 90 range. And thank goodness you and I are here in the Western Pennsylvania area to help in that regard. I want to thank you for coming aboard today, Dr. Roy. Thank you so much for spending some time with us. Folks, if you're living in the north, if you're near Portersville, he's a go-to guy, especially when it comes to thyroid and anything that's environmental. I want to thank you today. Enjoy your weekend, my dear friend. We'll be talking to each other in the very near future. And hope to have you back after October 5th. Fair enough. All right, folks, there you have it. Our guest today, Roy Kerry, our subject, thyroid disease. Until next Saturday when we come back and visit again for another 2-hour session, Dr. Dennis Courtney with Dr. Roy Kerry saying so long for Weekend Wellness Workshop.